Time now for our political roundtable. If you missed it, Governor Asa Hutchinson delivered his first remarks on the fate of the private option and expressed his interest in larger health care reform. In short, he asked legislators to extend private option funding through 2016 and wants a task force to create long-term solutions. I'm joined by Representative Laurie Rushing. She's a Republican from Hot Springs and the leader of the 40-member freshman class of the House of Representatives. Bo Ryall from the Arkansas Hospital Association, Michael Stock from QualChoice, the CEO there. Welcome to all of y'all. Thank you for being here.
Thank you for having us.
Appreciate it. Let's gauge reaction to the speech. I have joked, my friend Andrew DeMello with the Associated Press said it was the reaction was kind of like a Rorschach test. You know, everybody interpreted what they heard a little bit differently. I'll start with you, Mike Stock. What did you think from the governor's speech?
I thought it was a pretty pragmatic solution, kind of the best of both worlds. It allows the status quo to stay in place, but yet it gives us time to step back and reevaluate and decide what's the best solution long term.
Representative Rushing?
Well, I think from a freshman standpoint, we're kind of the group that's sitting back going, okay, we didn't have anything going forward in this, and a lot of us campaigned, you know, against the private option, and I think that this is a good solution. I think that the governor did very well, and I think that his reactions and are kind of giving us some leadership that we need.
Yeah.
So.
Did you hear from a lot of your other colleagues said the same thing, or did they stay kind of entrenched in their positions?
Well, I think that some of them are still entrenched. I think there's still some that's, you know, they wanted to just chop it off at the legs, as I always say, but you can't do that. We're talking about people. We're not just talking about numbers at this point. We're actually talking about people. So,
I know the hospitals were fairly positive in what they heard.
Sure, the governor gave us a plan to insure 200,000 people for the next 2 years and a pathway to study health care, Medicaid, private option for the next year. So we're supportive of that vision.
Do you think that politically, all three of you, do you think politically that his comments were open-ended enough to do this type of persuasion with other legislators in terms of what they need? You've been up there at the Capitol a long time, Bo.
Sure. I think he gave it an open end and talked about, well, we're going to have a discussion about healthcare reform, the private option, and we're going to have something totally new. So it may have some concepts of the private option. It may not. It will have some new components. So it's an open-ended discussion that he's going to have. You think members feel a way to help put their own stamp on this?
I think so. I think that especially the freshman class coming in, I think, you know, we're going to be able to have some input. We're glad that this task force is going to be started and where we can have some input.
You're going to be angling for a seat on that task force?
If they'll let me, I don't know.
Yeah.
I may have too much of an opinion.
No, I think they would welcome that up there. What does the private sector think of I mean, do you see a political solution here?
Well, I think there's two sides to this whole issue. One is the political, it's a social issue, so politically, that's their decision to figure out what they want to do socially. From my perspective in the private sector, I think what we could bring to the table is how's the best way to make this work economically, and what we can add there. So,
yeah, what have you been seeing with the private option in place that is working the way you hoped it would?
I think in general, you know, the transmission of information and the data back and forth is working pretty smoothly. We're having pretty good success with interacting with the people, but there are a lot of challenges there. This is a new population that hasn't really been in the delivery system, the healthcare delivery system, and so it's new to them. In the past, they've accessed the system just going to an emergency room, and now we're trying to get them to access the system in a lot of different places and maybe more economically efficient places than just going to the emergency room, and it's a challenge.
Behavioral change, though.
A lot of that is necessary, yeah.
I know the hospitals have recited some statistics in terms of the uninsured and what you're seeing with your emergency room visit drops and stuff like that, but where do you see the private option working like you hoped it would?
Well, certainly having 220,000 people who were previously uninsured, insured is a positive for the citizens of Arkansas, healthcare, and hospitals, but what we've seen is inpatient admissions for the uninsured has dropped 47%. We were concerned about, and certainly a lot of people were concerned about emergency department visits. Those have not increased, about a 2% increase. So we see it all positive right now.
You've been on the campaign trail in the last year, so you've seen the good and the bad from the private option. What have you seen in those two perspectives?
Well, I have seen that we have to weigh the cost, and I think that that's where the governor has come in good. He also realizes that we're going to have to weigh the cost, but I also see where we're having to talk about the people and the social aspect of it, and these people that have insurance that never had insurance. And so there is, you know, I did campaign. I was one of the 20 of the freshmen that campaigned against the private option for it to come to an end. And I think this is the beginning of a solution to work towards it's going to work better for everybody. And
your opposition being the fiscal ramifications of this, or
yes,
the state shouldn't
yes.
be involved in this?
Yeah, the fiscal.
Yeah.
Yeah.
So did you hear from people on the campaign trail that were for the private option, that were beneficiaries of the private option?
Well, actually in my area, I didn't hear a whole lot of pros. Most of them were saying, go up there and chop it off at the legs. But you can't just go in and, I mean, you can't go in, and we couldn't shut it down tomorrow. I mean, if he would have came in yesterday and said, we're going to shut it down Monday, I want you to shut it down Monday, we're going to run it through, that's not feasible either.
Yeah, and I think that was part of Governor Hutchinson's kind of genius solution in the speech there, is to give an end date that you can work towards that buys some political cover. At the same time, if it does turn out that that's what the task force recommends, there's at least time to do that. And if not, if there's a refashioning of the program, you've got the ability to do that. I want to pull up a quote here that Michael Stock put out publicly after this. You said, "We just can't sort of let it chug along, the private option, without really monitoring it and planning out what's going to happen long term." What needs to happen long term?
Well, one of the things that the Affordable Care Act provides is that in 2017, states can file for a complete waiver to revamp a lot of the things that are in the Affordable Care Act, besides just the Medicare component of it. And I think long term, that's a real option for this state. And with this task force, hopefully they'll take that opportunity to not just look at the Medicaid program, but what should we be doing for healthcare delivery and how we finance it in the state overall.
You get to wave a magic wand and get anything you want out of this debate on the private option and the whole aspect of Medicaid reform. What would you want to see happen?
I would just want to see that, to make sure that, I still want to make sure that we have people have insurance coverage, but I will also want to make sure that we can afford it and that there's no more taxpayer monies, whether it come from the federal government or the state, that we're not putting a tax burden on our citizens of Arkansas.
That'd be a tough one.
It will.
Yeah.
That's my magic wand.
That's your magic wand. All right, Bo, you get to rewrite the task force final recommendations. What do you want to see in it?
Well, we want to see the continuation of the insurance program of some kind, some coverage, expanded coverage, which in turn helps hospitals. We want to see hospitals survive and keep their doors open. We want to see those two components, and also there's the state budget component that we want to watch as well.
All right, Bo Ryall, Laurie Rushing, Michael Stock, thank you all for being with us today. Appreciate you very much.